Hi everyone, thanks for joining us. I'm here to talk to you about Calvert Hospice and give you an overview of some of the services that we provide here in Calvert County. My name is Sarah Simmons. I'm the Director of Quality and Compliance here at Calvert Hospice. I've been a nurse here since 2008. I am certified in hospice and palliative care and am active locally and nationally in hospice and palliative care organizations. A few of the items that I'm going to review today are some of the basic aspects of the Medicare hospice benefit, some of the signs that an individual would benefit from hospice care. We're going to talk about how to make a referral to Calvert Hospice and review how hospice care is provided and in which settings. And then we'll have a few Q&A slides for some of the common questions that were asked during live presentations. What is hospice care? We provide support and care for individuals in the last phases of a life-limiting illness. We recognize that dying is part of the normal process of living, and our goal is to affirm life, not to hasten or postpone death. We focus on quality of life for individuals and for their caregivers, and we treat the whole person, not just a disease. Hospice focuses on the needs of the patient and the family surrounding them. Hospice is part of the Medicare Part A benefit, similar to skilled nursing or hospitalization. Most private insurance companies also offer a hospice benefit. So while copays do sometimes apply for private insurance plans, costs for hospice care through Medicare are 100% covered, so there typically are no out-of-pocket expenses for hospice patients under their Medicare benefit. In order to be eligible for the hospice benefit, individuals must have a terminal illness with a life expectancy of 6 months or less if the disease progresses along its usual course. They must agree to accept care that is focused on comfort and palliation of the terminal condition, instead of care that is focused on cure. And they must sign a statement choosing hospice care to treat the terminal condition, instead of other Medicare covered benefits such as home health or hospitalization. Is hospice only for cancer patients? The answer is no. Hospice care can be provided to anyone with a life-limiting diagnosis. Some examples are end-stage heart disease, lung disease such as COPD, kidney disease, liver disease such as cirrhosis, dementia due to Alzheimer's or related disorders, stroke, Parkinson's disease, along with many other diagnoses, as long as a physician has certified that the individual does have a terminal prognosis. You should consider discussing hospice as an option if your loved one no longer responds as expected to curative treatments, expresses concern that the burden of treatment is greater than the benefits, experiences pain or other unrelieved physical symptoms, shows significant unexplained weight loss, experiences increasing needs for assistance with activities of daily living, makes frequent trips to the hospital or the emergency room, has fallen several times over the past several months, or has been told by a physician that life expectancy is limited. Hospice care is provided anywhere that the patient calls home. Calvert Hospice provides care in private homes in Calvert County, at the Burnett Calvert Hospice House, our 6-bed residential hospice facility, at Asbury Solomons Nursing Center, Calvert County Nursing Center, and Solomons Nursing Center, at a variety of assisted living facilities and group homes, and in some situations at Calvert Health Medical Center. If you're interested in talking to hospice about providing care for yourself or a loved one, there are many ways to make a referral. The most direct method is to call our main office at 410-535-0892 to speak with a nurse 24 hours a day. You can also speak to your primary healthcare provider and ask if hospice is right for you or your loved one. Or you can send a message through our website at calverthospice.org or email information@calverthospice.org. But please keep in mind that the website and informational email address are not monitored 24 hours a day, so calling our office is still the most direct method to be connected to our intake team. So what happens after you make a referral or your healthcare provider makes a referral? Our intake coordinator discusses the patient's case with our medical director to ensure that eligibility criteria are met. Then we schedule an enrollment visit with a hospice social worker or a hospice nurse. During this visit, the hospice staff member will meet with the patient and family to review consent forms, discuss questions or concerns, and give the individual or their authorized representative the opportunity to elect the hospice benefit. After election of the hospice benefit, an admission visit with a registered nurse occurs. During this visit, the nurse will perform a comprehensive assessment, including a physical exam, review of disease history and problematic symptoms, and a full review of all of the medications that the patient is taking. And all of these steps typically occur within just a few days of receiving a referral, often within 24 hours. Within the first 5 days after electing the hospice benefit, each patient will receive a visit from a hospice social worker, a chaplain, and a hospice aide if desired, and contact from the volunteer coordinator to assess volunteer needs. Each discipline will plan visits and phone calls according to the needs and desires of each patient and family. Some patients may receive multiple visits per week from a combination of disciplines, while others may receive primarily nursing visit with support from additional disciplines only as needed. The care that's provided by the hospice interdisciplinary team is customized to each patient and family. The members of the hospice team work together to care for each patient and family. Team members visit on schedules based on patient and family needs. Members of the hospice team include the hospice physician, registered nurse, social worker, chaplain, hospice aide, who is a certified nursing assistant, volunteers, bereavement counselors, and additional team members such as dietitians, occupational or physical therapists, and pharmacists as needed. The type of hospice services that each patient and family receives might vary depending on their needs, but in general, patients receive visits and phone calls from each member of the hospice team, access to a nurse 24 hours a day for answers to questions via phone call or for visits if needed, medications to ease symptoms, durable medical equipment such as hospital bed, wheelchair, and oxygen, medical supplies such as wound care and incontinence products, help with developing or revising advanced directives, help accessing benefits and community resources, short-term inpatient care for respite or for unmanageable symptoms, and short-term continuous care at home if needed. The Burnett Calvert Hospice House is a 6-bed residential hospice house located in Prince Frederick. We've provided care at the hospice house to more than 400 individuals since it first opened in 2010. All 6 rooms are private rooms, and care is provided 24 hours per day by our staff of nurses and certified nursing assistants. Room and board fees do apply and are typically not covered by insurance, but a sliding scale is available for interested patients. So we're going to go over a few frequently asked questions that often arise. When is the right time to ask about hospice care? Although end-of-life care can be very difficult to discuss, family members should share their wishes with each other before it becomes a concern or a full-blown crisis. Having these discussions well in advance helps patients and their loved ones make educated decisions regarding the type of care that they want. So if you think that you or a family member might be appropriate for hospice, please contact us sooner rather than later. Will hospice make my loved one stop taking all of their medications? Will my loved one be given medications to hasten their death? No. The hospice team will perform a comprehensive review of all of the medications, and there may be some that are no longer contributing to the palliation of the terminal condition. Some of these medications may even be causing more side effects and more burden to the patient than what they're actually doing to help relieve symptoms. Those medications would no longer be eligible for coverage through hospice or through Medicare Part D, so they would become patient pay if the patient decides that they want to keep taking those medications. Calvert Hospice never administers medications with the intent of hastening the dying process. What happens when a hospice patient dies at home? When a hospice patient passes, the nurse makes a visit to help support the family and coordinate care with a local funeral home. The hospice nurse helps to discard medications, bathe and dress the patient, notify the primary physician, and contact the funeral home. Medical equipment will be picked up by our contracted vendor within 1 or 2 days of the patient's death, and hospice team members will reach out to the family to ensure that there are no additional needs. Within a few weeks, the hospice bereavement team will reach out to make a plan for ongoing bereavement care. How does Calvert Hospice support family members, both before and after a loved one passes away? Calvert Hospice cares for both patients and their families. Our team always makes sure that caregivers and family members receive the emotional and spiritual support that they need. We offer a variety of bereavement services for adults, teens, and children grieving the death of a loved one. Bereavement services include individual counseling, virtual and in-person support groups, and memorial services, in addition to our numerous offerings customized towards children and teens. Some additional resources to consider looking at if you are interested in more information about hospice care are our website, the website for the National Hospice and Palliative Care Organization, the National Hospice Foundation, the Conversation Project, and 5 Wishes. Both the Conversation Project and 5 Wishes are excellent resources to help individuals and their loved ones begin having those difficult conversations about wishes towards the end of life. And the Calvert County Office on Aging, which is a wealth of information about additional resources that are available to seniors in our community. If you'd like more information or have any questions or feedback about Calvert Hospice, please visit our website, call us at 410-535-0892, or reach out at information@calverthospice.org. Thanks for joining us.